So the idea we've got is about using movement as medicine, and it's not a new idea. Exercise has always been touted as a great solution for lots of illnesses, but how to approach movement as medicine is not as easy. And usually the idea that people have about exercise as medicine is confined to a few specific exercises, and how to use all sorts of movement for all sorts of diseases, and each disease will have a different sort of an approach when it comes to movement, and that is what we are trying to explore in this series on movement as medicine. So I'm hoping that this particular series generates enough interest to create some audience questions, and what I'm hoping to do is have a conversation based on those seed questions that I receive from the audience, and then develop the series into a conversation that you can be a part of. Today's topic, just to start off, is about using movement as medicine for elderly people who want to prevent falls, who are afraid of falling, who have already fallen, or they have not fallen yet, but they know they are on their way to falling, and they're trying to prevent it. So that's today's main topic. This is Ashwin. Ashwin's a friend of mine, and Ashwin's dad had come to me last week with complaints of feeling a little fearful of falling. He's actually a very healthy person, but he came to me of his own initiative, saying that my balance is not up to the mark. I've not fallen yet, but I know I will fall, so you need to help me. And this is something that I've noticed recently, because people are starting to approach the problem proactively, which is very different from what it was.
They're more aware. They're more aware of
more aware of it. So 20 years back, when I started practicing medicine, nobody really cared about preventing falls. But people used to fall all the time, and they used to get hurt all the time. But then they used to turn up to hospital and get the bone fixed. But then they never really fully recover.
Yeah, because they're still afraid of falling again.
They're still afraid of falling again. That's one part. And the second part is that once they fall, they're going to spend 2 or 3 months in bed. And within those 2 or 3 months, they lose muscle at a rapid pace, because anyway, past 50, you have a tendency to lose muscle. And if you don't move, you lose muscle faster. And people who fall and break a bone because their bones are not dense enough or strong enough, they're already elderly, and they're already in the phase of losing their muscle faster and faster. And this is that final straw that breaks the camel's back. So they fall, they take 3 months rest, and then they stand up and they can't move. They've lost range of motion, they've lost muscle mass, and now they're in a worse position than before. So they have less balance now, and they're more at risk of falling, and their bones have become even more brittle. And so now they refuse to move, and they don't want to walk, they don't want to even think of walking. And that is usually the pattern that you see elderly. So they'll fall once and they'll not want to walk anymore.
So what's a good place to start? Like food, like for that. So muscular skeletal strength, right? That's your protective agent. Like that will keep you from injuring yourself. That's your shell basically. So more muscle you have, the better you fall.
Yeah.
Right.
It's armor.
Armor, exactly.
So you can have armor. You can have So you've seen in European countries, you'll see people walking with hip protectors. So there's a long enough piece of plastic with foam padding inside, and it's applied to the outside of the legs, so that when they fall and they fall onto their hips, they don't break the neck of the femur. And that is armor. That is body armor. But the body itself has its own armor. It's got cushions of fat. It's got muscle, and then you got the bone. So the impact should go to the bone last. Most of the should be taken up elsewhere. It should be taken up by the muscle and the fat layers before it gets to the bone. And most older people don't have enough muscle
or
fat covering their bones, and that's why they break them. That's one part. That's the armor part. So that is the passive protection that muscle provides, is as body armor. But there's active protection. Now you must realize that people are falling not just because they're having an accident. It's because they can't recover their balance once they start falling. So unless you're strong enough to
Correct.
and fast enough to correct your movement, so if you trip over something and if your muscles are not letting you move fast enough to correct that position, that's one thing. And the second thing, once you're on your way down, is your leg strong enough to support you before you keel over? Or if your legs are not going to support you, what about your hands? Is your upper body strong enough? So muscle has that protective ability at multiple levels, as a passive method, as an active method. And for somebody who's used to moving, somebody who's used to moving fast, somebody who's used to correcting their direction fast, their nervous system is also fast enough to command those muscles. So it's not just the muscle, it's also your nervous system. So that's how you prevent falls. That's how it's a lack of strength and a lack of training in movement is what causes falls. And once the fall has already occurred, you get an extra level of protection because of that extra muscle. So that is where we start. How do we prevent falls, and how do we prevent fractures once the falls have occurred? And and in general, if you ask an elderly person, are you exercising? I see lots of elderly people and they all are exercising, but they're only walking. Walking is not enough. Walking is a bare minimum. It is something that the body is really efficient at. The human body is designed to walk, and it needs very little energy to walk. It needs very little reflexes to walk. You need very little strength to walk. So even somebody with very minimal strength can manage to
walk on a daily basis.
Yeah. So walking on a daily basis is bare minimum.
It's great, but it doesn't.
It's good. Yes, of course it's good. So never stop walking, because the walking is also challenging your cardiovascular system.
Eyesight, lots of things.
Yeah. So and so that's not enough though. You always need that extra reserve protection. That's where you need strength training, muscle. Now, when you talk about strength training, the immediate mental image you've got is going to a gym and doing bicep curls. It'll help, but that's not enough. You need more of a sort of a functional, something that they can relate to on a daily basis. Now, most elderly people find it difficult, the following difficulties. They can't get up off the floor once they sit. So therefore they'll refuse to sit on the floor. So now that leads to a stiffness in the joints, that leads to inability to sit on the floor. So they won't practice it and it'll get worse. Disuse atrophy. Yeah. That's one problem. Then the other problem is they can't lift something and walk with it because they're getting out of breath, or they're not strong enough to hold it, or they feel unbalanced when they're walking with a weight. That's the other thing. Or they're finding it difficult to climb upstairs. They're fine on the flat, but climbing upstairs is not easy. They will attribute it to knee pain, or they'll attribute it to shortness of breath, but at its base, it is a lack of strength. So these are the usual problems that you'll find for elderly people. Now, the fourth problem you'll find in an elderly person is that they know that if they trip, they're going to fall for sure. So that quick response and the recovery once they have tripped is not happening. So all of these things,
they won't take the risk.
Yeah, they won't take the risk. So, and if you ask them to go to a gym and do exercises in a machine, there is no training of the balance system, there is no training of coordination, and there is not enough carryover into real life.
Yeah, like going grocery shopping and carrying your bags.
Carrying your bags. So basically you need to train for life. And so that was what I was trying to get your dad to do. So I had asked him to sit on the floor and stand up. I had asked him to pick up a weight, hoist it over his shoulder and walk up and down the room. So having that weight on one side and having that imbalanced weight on one side is now going to force him to counter. And lots of people are fine when they're walking in a straight line, but you ask them to dodge an obstacle, move sideways, turn, that's when they lose their balance. So that's because they're not being trained in being pulled to one side or the other. So which is why I asked him to
Put the weight.
weight on one side. Then the other way to train is to grab a weight and swing it around you. So now the weight is going to pull you side to side, and you're going to learn to balance with your feet. So if you're able to handle a weight that is swinging that way and pulling you that way, walking on rough surface or suddenly changing direction becomes easy. And I asked him, so when you're training strength, you need to train in a manner that is
Function.
difficult. Okay, walking is not difficult, which is why everybody is so happy
Easy,
walking.
Yeah.
Strength training is difficult. So if you're lifting a weight, if you're lifting a weight more than 30 or 40 times in one set, that weight is too light for you to stimulate any
growth,
significant increase in strength. So training strength requires a willingness to undergo difficulty, and that is not a part of our
Conditioning.
Nobody wants to do difficult stuff, and that is normal. That's evolutionary.
You want the easy way out.
You want the easy way out. So and the other part of it is, doctors and health professionals, physiotherapists, all of us ask our patients not to exert themselves. And that is exactly what you need to be doing. You need to be exerting yourself, but we are asking them not to.
Yeah, because you don't want to deal with their problems after.
So for example, I've asked your dad to walk around with a weight on his shoulder, and this is definitely going to cause some aches and pains. It's definitely going to cause him to lose balance, and there's a good risk of him falling down. So that is a risk I have to take, but I'm willing to take that risk with him because I trust him as a patient and he trusts me as a doctor. That sort of a rapport between a doctor and a patient doesn't exist anymore. And so you can't really
take on the liability.
Yeah. So you've got to find ways to get around this. And so instead of walking, so if you need to be able to creatively regress a particular strength challenge before you ask somebody to do something. For example, if I'm asking somebody to do an overhead barbell press, I have to assess if that patient is capable of that range of motion. I have to make sure that the patient does not lose balance with
while being up there.
Yeah. So, and if I find that there is a problem with the overhead barbell press, then I should be able to give them an alternative. Or I should be able to break down that movement into multiple parts and do them piece by piece safely, and then finally integrate that movement into one smooth movement. So it's not, you can't approach this in a formulaic manner. You've got
each person is different.
Each person is different. You'll have the basic structure, and you can use that basic structure to guide how to train these individuals. But when you train them, you need to be able to make changes in that basic structure so that it's suitable for them and is not putting them at increased risk. So there are multiple ways to do that. If you've got questions.
What about basic movements like say squats or holding a plank or push-ups? Those are basic things which they might have done at some point. Is that something they can get back to, or is it useful? I'm sure it's useful.
Yeah, so that is exactly how you would want it done.
Get started.
So you will start off with essential patterns of movement.
Yeah, body weight.
Yeah, so squatting somewhere, just sitting in that squat and getting into that squat and being able to hold that squat without pain.
Stay there,
Now, obviously, most people are not able to squat because they've lost that ability.
They haven't done it for the past 20, 30 years.
So you'll have to regress it. You'll have to find ways to make that squat easier. And there are videos on the channel to show you how that is done.
How to get back on the squat.
Right. So squat is a basic pattern. A loaded carry is a basic pattern. So you should be able to pick up a weight and
like
carry it. A farmer's carry or a rack carry or an overhead carry.
No, that's later. Like a
suitcase carry. So a loaded carry is another pattern. A very safe pattern that you can use is the quadruped pattern. So on all fours.
Okay.
So crawling is a very safe pattern.
Yeah, you're as close to the
Yeah,
floor
as close to the floor as possible, and you got 4 points of contact on the floor, and you're not going to fall.
you can slide down if you want.
Yeah, if you're tired, you just lie down on the floor. Of course, there the problem is, it's just a mental block, because I can't be crawling. I'm an adult. I shouldn't be
do I
having
want?
fun. It shouldn't be, and also what happens if I get on the floor and I can't stand up? So that is exactly what you
Where the
need to train. So because if you're on the floor, you need to be able to learn how to get up. Now, if you have to get up off the floor using your hands, that's fine. Start off with doing that.
Something.
Yeah. So there's the squat, there's the loaded carry, there's crawling, then there's the hang. So this is
Grip.
So yeah, you grab onto something and you hang somewhere, and that decompresses the spine. So you'll find people losing height as they grow older. That's because the spine is getting compressed, the vertebrae are getting compressed, and the vertebral discs are getting compressed. And that you can counteract that with a bit of attraction from hanging somewhere. And again, it doesn't mean you just hang like a monkey. You don't have the strength enough for it. So you'll work on it. You'll regress the movement. So there are different ways to regress that movement. And you need to train your feet, your hands, and your core basically. And the rest of the strength is quite easy to get. But what you need to focus on is the grip, the strength of your feet, and the reactivity of your feet. Feet, when it comes to feet especially, elderly people especially have spent a lot of time in shoes.
And they still do at home.
Yeah, and that's because they've been asked not to go barefoot.
Yeah, especially at home when they're like it's too cold.
Yeah.
They have chappals on all the time.
All the time. And so that means their toes stop working. And the toes are integral to balance. So I've had a patient who walked in staggering and unable to stand on his own. He had friends and relatives on either side, and he was staggering. All I asked him to do was get his fingers in between his toes, like that, and twist it around for 5 minutes. Not even 5 minutes, 30 seconds on one foot, 30 seconds on the other, and then I asked him to stand up and he could stand. That's all I did. 31 minutes of work. So this going barefoot and getting your toes working, all of these are crucial parts of balance and preventing falls when it comes to the musculoskeletal system. We didn't talk about the eyesight or about your balance from the ear or about just the circuits being challenged on a daily basis. And people stop jumping when they're 50, and that loss of springiness, all of that. So all of these challenges that we used to have as a child, we've stopped taking them, and the body decides it's time to get old.
Yeah, you don't necessarily need to get old.
You will get old, but you don't need to feel old. Yeah. If you start challenging yourself the way a child does, is the nervous system will learn.
Handle it. Yeah.
Will learn how to handle this, but unless you ask it to, because it's expensive. It's expensive for the nervous system to learn how to challenge itself. It's expensive for the muscle to build. It's expensive for intense movement to take place, and the body doesn't want to spend that precious energy on difficult stuff. But the interesting part is, if you keep challenging the body and if it keeps building reserves, it is going to find it easier and easier to do your day-to-day stuff, and you're going to become stronger and safer as you get older, instead of getting weaker and more frail. And you can turn back the clock. Your age does not have to depend on the number of years you have flipped the calendar. You can feel younger. You can actually be younger, even though your age is a number, particular number. So that's strength training.
It depends on activity and what you do with it.
Yeah, the cardio, the walking, the jogging, the cycling, all of that's fine. But unless you strength train and unless you maintain your muscle, you're going to get frail and weak much faster. And most of the running groups that we've got now are all focusing on strength training because they've come to that realization. Even patients are talking about strength training, and that is a welcome trend.
Yeah. So along with the strength training, what about the food? That's very crucial.
The food, yeah. So there's as people get older, their digestive systems start to lose the ability to produce enough enzymes, and so every time they take a heavy meal or they take a meal that is full of protein, their body is not able to keep up by producing enough digestive enzymes, and they feel a little discomfort.
So they cut it out of the system.
And they cut it out of their system completely. They stop taking meat, and of course there's this constant bombardment of the message saying meat is bad for you, meat is bad for you, and they stop taking meat.
But if you don't eat meat and your body requires a certain amount of protein on a daily basis, will it not take it from your body? Like it'll start eating up existing muscle?
So there is a basic minimum requirement of protein, a recommended daily allowance of protein, which is around 0.7 to 0.8 grams per kilo body weight.
Yeah. So
but that's too low.
If you're 50 kilos, you need 50 grams, say.
Less than 50 grams according to RDA, according to your recommended daily allowance. But that's too low. You need to have at least double that.
A little more than that.
A little more. Now, and since people are worried about meat, they go for legumes and
that doesn't do the same job as
no, because those proteins are a lot more difficult to absorb, and they also come in with their own set of carbohydrates which we don't need that much
unless you're exerting.
And so they go for plant-based proteins. They are still proteins, but they're going to be a lot more hard work for the body to absorb.
Yeah, you need a lot more.
You need a lot more quantity. You need to eat a lot more, and it's going to cause its own set of problems. And if you stop using animal protein, your body is going to think, okay, I don't need to digest all of these proteins anyway, so I don't need the enzymes. I don't need to.
You won't maintain the gut bacteria for it.
So for somebody who's wanting to go back onto animal protein because they know it's better for them to easily digest, they'll have to gradually build up the capacity to eat animal protein. You can't go and binge on meat the first day you start. After several years of not eating meat,
you go back. Start with, say, bone broth.
Yeah, and then gradually build up.
So bone broth has collagen, which is also helpful for your bone.
Yeah, so the collagen is So collagen is the basic structural protein in every tissue of your body. That includes your skin, your hair, your bones, your muscle. And collagen is now missing from our diet almost completely. So collagen comes from the cartilage and from the tendons and the ligaments, and these parts of the animal are not fun to eat. They're very chewy, they're tough to chew, and they're tough to cook, and so
they're considered cheap.
They're cheap and not, so people don't take enough collagen anymore. Once upon a time, when meat was expensive and meat was more valuable, people used to eat a lot more collagen because they wouldn't waste any part of the animal.
You'd make a soup or a stew with the bone
in it.
And again, there might not be meat, but there'd be a taste
of meat, and the collagen would be dissolved into the curry or stew or soup that you're making. And this lack of collagen led to a weakening of the entire body structure. It's also, if you don't get enough collagen, your gut is also not going to work very well. So having a poor amount of collagen in your diet makes your digestive system worse. And now you're going to feel worse when you try and eat anything, including meat. And so you'll stop eating. And this gets into a vicious cycle. So when you want to heal your digestion, when you want to start eating better, you're probably going to have to start off with a good source of collagen. And going for an expensive collagen supplement, which gives you a tiny amount of collagen, doesn't make any sense to me. Because I tried one of those collagen supplements, and for 1,500 rupees I was getting that much, and I'm taking a teaspoon a day. But for 100 rupees I could get bones which last me 1 week. So there's no, and it tastes better.
Yeah.
So So that's collagen. Where were we? Food. So protein. Now, so when you're trying to build the capacity, so this doesn't mean that you need just animal protein. Now, if you are short in protein, if you're eating well, if you're eating a lot of meat, you're eating a lot of protein, whether plant-based or animal-based, it doesn't matter. If you're eating well and you're not exercising, that protein's wasted, because there's no demand from the body for these amino acids, and
so it's excess.
Yeah, so it's excess, and that excess protein is then going to cause trouble. So when people talk about eating too much meat causing trouble, this is also part of lack of activity, lack of strength training, not enough challenge to the musculoskeletal system in order to stimulate a protein demand. Without that protein demand, if you just keep feeding yourself with meat or plant-based protein, you're going to end up in trouble. And at the same time, if you're short on protein in your diet, but if you're maintaining a high level of activity, your body will scrounge and find protein from wherever you can get. So, which is why plant-based diets will work for some people, because they are maintaining the appropriate amount of activity and strength challenges, and the body will find a way to extract protein out of the plants that it's having. So I get asked the question all the time. So there's so many vegetarians in this country and they're all doing well. They could do better if they're on meat, but that's okay. They're doing well because they're physically active. The moment they become inactive, that vegetarian diet starts to turn back and bite them. So
yeah, if you're spending what you've consumed, it's fine.
And you need to be, it's not just spending what you consume, it's the body needs to have a reason to absorb this protein. Yeah. So if I challenge this muscle today, and if it's broken down because of the exercise, and the body knows it has to rebuild it, it's going to ask the system for, where's my amino acids? And if there's no demand of that sort, the body is not going to absorb it. It's going to hang around in your system, in your gut, and it's going to feed the microbiome in the wrong way, and you're going to end up with problems of that sort. Or you're going to have an excess of amino acids just floating around in the body, and that then going to uric acid, or it's going to trigger unnecessary growth in tissues that are not supposed to be growing. So this is how non-vegetarian food increases the predisposition to malignancies. So if you're eating non-vegetarian food and if you're eating a lot of muscle meat, you need to make sure that you deserve it. You need to make sure that you're challenging your body enough to consume that amount of meat. A small amount of meat is fine, but if you're overeating, if you're eating much larger quantities than usual, make sure that you have a reason to eat it.
So older people need to add that just for their sustenance.
Yeah.
If they
So my point is, more than what you're eating, if you give a signal to the body in the form of exercise, it is going to find the protein that it needs from whatever crappy diet that you're having. Now, if you're exercising so hard that you can't recover fast enough from that exercise, then that means your protein is deficient. But if you're recovering well from your exercise sessions and your strength is improving day by day, then there's no worry. You don't need to go in looking for more and more protein in your diet. So I think the focus should shift back to exercise rather than dietary protein intake.
Okay. That's good. Yeah, start with the exercise.
Start with the exercise and the body will tell you how much
you'll need more.
And you've got, when the body tells you that you need more, you've got two options. You either increase the amount of protein or you cut back on the exercise. And I would say eat more rather than cut back on the exercise.
Yeah, and I think as you get older, you have to consciously increase the amount of exercise you do, because you're not as active as say you were in your earlier days when you had your routines are different.
Yeah. So when you're older, you don't need to work as hard as you were when you were at your prime. So you don't have a job to go to now. You're not lifting heavy weights and
moving furniture.
Yeah, so there's not much of a musculoskeletal demand in your day-to-day life, and you need to provide it from the outside. You need to have a structured regimen of some sort that makes sure that you're challenged on a daily basis, and something that you can measure yourself up against. And unless you've got that constant measuring of yourself, unless you can see that you're making progress in strength, unless it is pointed out to you that you are losing strength on a day-to-day basis, you don't have the motivation to do that. And most people don't even know that they are losing strength. It's one fine day that they start to stagger. That's when they realize, oh, I've lost strength. And by that time, it's probably a little too late. Of course, you can turn it back.
But it'll be harder.
It'll be harder.
Yeah. What about like daily activity? Like, so right now you have a lot of people who have help at home, cooking, cleaning, doing all that. But doing that on a daily basis on your own as an older person, it just keeps you more physically active, it keeps you more agile. Like there's a lot more coordination, balance, stuff like that comes with it.
Yeah. Daily activity is not going to challenge your strength.
No, as in like for
of course it's helpful.
Movement and
of course,
like coordination and stuff.
Of course it's helpful. Think about movement just like diet. So you've got your daily staple stuff that you eat, and then you've got the extra supplements, and then you've got the extra good stuff, superfoods. So your daily activity will be the baseline of your diet, movement diet. And then you need to do an extra 3 days of cardio, and you need to do an extra 3 days minimum of strength training. And that's that.
For that strength and balance and those bits.
Yeah. And as you get stronger, you don't stop. You never
add.
Yeah, you never stop. You never be satisfied with what you're doing when it comes to the strength training. You need to keep pushing yourself.
Yeah, because strength means you say you can't pick up 10 kilos today. In a month you can be able to.
Yeah.
But then you shouldn't stop there.
Exactly.
You should make it 12.
Yeah.
You should make it 15. You have to keep upping it. Because otherwise it'll peak and you won't be able to maintain.
So if you start lifting 10 kilos on a daily basis and becomes easy for you, now your muscle starts to become more and more efficient, and it'll make do with less muscle fibers to lift the same 10 kilos. So because it's a movement pattern that has been grooved properly, so you shouldn't let the muscle
stop there.
So once 10 kilos becomes easy, you need to start moving up to 12.
Yeah.
Or once you're lifting 10 kilos for 10 reps and you find that easy, you should start thinking about increasing the number of reps to 15 or 20. Of course, when you go beyond 30, you don't get that same strength challenge and now you spend a lot more time in the gym. That's not good. So increase the weight, reduce the reps, and then it's the same thing. Now, if any of the listeners or the audience, you've been to a gym with a couple of friends, you'd know what it was like. You'd start lifting a weight and your friend would match you, and there'd be some sort of a healthy competition, and you'd keep pushing each other to get stronger and stronger, lift a heavier weight this time. So that sort of a culture it's not there in the elderly population anymore. So older people need to start going to the gym in groups, or they need to start looking for places that will train them in groups so that they can have that community support that we used to have when we used to go to the gym as a group, as a bunch of 3 or 4 friends. And that needs to come back. They need to go back to their youth, they need to go back to their childhood, and they need to start enjoying this. Right now, walking has a community of that sort, because they're going out and they're friends and they're egging each other on, and they are challenging each other on a daily basis, and it's fun for them.
They have a start.
It's fun for them. And the same thing needs to come over to strength training. And one way to do that would be to get your friends who are in the walking group of yours to start joining you on your strength training sessions. And one way to do that would be to incorporate the strength training into the walking session. Carry a weight while you're walking.
Yeah.
So it's a 5 or a 10 kilo weight in one hand. When you get tired, you hand it over to the other side. And once that hand's tired, you hand it over to your friend.
Yeah.
And then you make fun of each other when you can't hold it as long as the other person.
It's a very functional way to do it.
So this is how you challenge yourself. And between 4 or 5 of you, if you're carrying 2 or 3 weights, anybody who gets tired can stop. And if you don't want to carry weight, you can carry plastic bottles filled with sand. And if you get tired of it, empty the sand out and walk home.
What about like ankle weights, wrist weights? Are they in use?
I would prefer they held weights in their hand, because now it works their grip. And having a weight on the ankle is not functional. The body tries to hold most of the extra weight that it has close to its center of gravity. And the further it's away from the center of gravity, the tougher it becomes for the body to balance.
Stability.
So I would like the weight to be close to the hips. So which is why hands. And hands are meant to carry weight.
Yeah.
So that is, so strapping something onto you and walking around is different from carrying something in your hands. So yeah.
What about it? Okay. So carrying is better.
Carrying is better. Holding stuff in your hand is better than actually carrying something on your shoulder on a rucksack. You can carry much heavier weights on your rucksack
For
longer, but I wouldn't like that in the elderly population, because the spine has already had years of compression on it, and I wouldn't want something. Now, when you're holding a weight in one hand, it's different. It's not a uniform compression, and this hand is going to complain long before the spine does.
So you can switch.
So you switch and you transfer that load repeatedly.
So a good place to start is groceries.
Or I mean, if you tell your clients that walking with groceries is all the exercise that you need, they're going to stick to that. Which is why I say daily activity is not considered exercise. You need to have specific times of the day.
Add a routine.
So 20 to 30 minutes thrice a week would be a good place to start.
Yeah, and again, if you add the numbers up, it will be cheaper than medication.
Very cheaper than medication, and better quality of life.
Wellness, it's not just the health; it's the wellness, well-being. There's a lot of other aspects that add on.
Independence.
Yeah.
Now, if you go shopping, you don't need to wait for your friends and family. I mean, your family, younger family members to drive you there or carry the stuff for you, or you're not worried going for a walk in the mall because you're strong enough to cover it. So if you're able to walk 5 kilometers with 5 kilos in your hand, you're going to be able to walk in an air-conditioned mall for 10 kilometers. Yeah. So that is how you train strength. So
long-term quality of life.
Yeah. So you're not going to fall. You're going to be more independent. And if something's on the floor and you want to get to it, you can get down on the floor, pick it up, and stand up again. You're not worried.
You'll be stuck there.
Now, suppose by some ill luck you do fall, you are going to be able to stand up on your own without waiting for the ambulance to turn up 2 days later. So that's not. Yeah, so that's why strength training. So
you have a list of exercises that are there specifically for older people on the. You could put a playlist.
I could put up a playlist on the basic essential exercises that older people need to practice on a daily basis, and how to practice loaded carries. I already have a video on loaded carries, so that should be fine.
Just put it up as
I added
playlist.
As a playlist. And and if you've got doubts, please take a look at the video and post them in the comments so that I can put up answers as videos or as comments itself. So thank you for watching. Thank you for listening. Please let us know how we've done.